Hi, my name is Eftychia and I am an epidemiologist in the Population Health Sciences Institute in Newcastle University. I moved to Newcastle from my hometown in Greece over 2 years ago to start my PhD. So for my PhD I study how dental problems are associated with health outcomes, which are common in older people. If there is a link, this means that we will be able to improve people's health and reduce illness. Other people in my institute study topics like health inequalities, cancer, aging, and nutrition. As an epidemiologist, sometimes you have to collect data directly from people, which means that you need to be friendly and approachable and have good communication skills. But also, maths is important too, because once we have collected data, then I have to analyze them and see if there are any interesting patterns. So think of an epidemiologist as a health detective, where you need to find clues of where a disease is coming from and how it is spreading. The most famous example of this comes from the cholera outbreaks in the 1800s in the UK. So back then there was a doctor called John Snow, and he suspected that cholera came from contaminated water. In other ways, that people were getting infected from cholera through water. So during one of the cholera outbreaks, he made a map of the victims and where they lived. And he discovered that most of them lived around the same street in London. He then collected more information on the victims and visited their houses and asked their relatives where they were getting the water from. He found out that most of them, as he suspected, were getting the water from the same water pump, which interestingly was situated in the street of the outbreak. Once he had collected all this information, he went to the council and presented it and asked them to remove the pump handle from this pump. And as a result, the outbreak subsided. So this is what field epidemiologists do these days. Once there is an outbreak, you need to find the source, where the disease is coming from, how it is spreading, and find ways to stop further transmission. So let's talk about COVID-19. Once we knew where the virus was coming from and how it was being transmitted, then health professionals try to find infected people but also trace their contacts in order to stop further transmission of the virus. So in a way, like Jon Snow, they had to make a map of contacts. And this is what I'm going to ask from you to do today as a fun exercise. Think of all the people that you came in contact with during a normal day before lockdown. So here's my example. So I would go for running with my friends, then I would go to the office where I would push the button in order to enter the building, and I would go to the common kitchen to make my coffee, and sometimes I would use the common coffee machine. And in the meantime, I would have some discussions with my colleagues. But also I work in an open space, which means that there are many people around me. At least I would say 10 people. So let's think about it. During my typical day, I came in direct contact with 15 people. But also, I came in indirect contact with many, many more people, because the button that I would push to enter the building would get pushed by so many other people, let's say hundreds. And also, think of the common coffee machine and all the common surfaces that I would share with so many other people who were in the building. So this is why during this outbreak, it's important to limit our contacts with other people and wash our hands. So how does your typical day look like? And what have you done to reduce contact with other people?